Today our threat is focused on geriatric medicine, medicine for the aging, podiatric medicine, foot medicine, infectious diseases, with your USA Prepares instructor, Dr. Meccia from Illinois. You'll meet him for 2 days at the Expo. He is our seminar speaker at Get Prepared Expo. Class, today's threats are to you and your family, as evidenced by sickness worldwide. Many of the problems that we face are directly and indirectly caused by the politicians that we naively elect to represent our interests. Class, what would happen if someone did what politicians do to you where you work? I'd fire them. Your lesson today is centered on health. Times are bad, and they most certainly will get worse. Class, you need to be healthy. Dr. Fred Meccia is live with us via technology. Welcome, Dr. Fred Meccia.
Good afternoon, gentlemen. And Vince, what an incredible introduction. You're absolutely right. I first wanted to say thank you so much for you and Mark Wright to have me on your show and to discover me and to invite me to the Expo. I planned to go anyway, but I think it's the icing on the cake. And I also wanted to thank very much Mr. John Moore and Mr. Tim Spencer for their cooperation and for their encouragement also.
Dr. Fred, John Moore, also known as J.R. Moore, is a guest and an instructor at USA Prepares. He also will be at the Expo. And for you new class members, John Moore is a climate change researcher, and he talks about violent climate change and what's happening. And so there's a circle of instructors, John Moore, Mark Wright, me, and there's a host of others. Dr. Meccia, it seems that to me and to Mark, that as a nation, we are becoming sicker and sicker. Do you agree with that?
I do. You would think that in modern times, in this day and age, that we would be phenomenally healthy and very robust, but it doesn't seem to be the case. There's a whole bunch of indicators out there that show us that that's not the case. We have a high obesity rate in this country, which is really to the point where it's of great concern, because obesity will lead on to many other causes of diseases or add to it, and it presents an incredible problem. And for the students out there that are truly interested in preparedness, because I think preparedness is part of staying healthy, and we want to stay healthy because of what's coming. The shocker for us, doctors of all disciplines, is what's been coming down the line as far as Obamacare is concerned. We, at our medical conferences, we usually had just in-house physicians talking about various procedures and what's happening in the world of medicine. More and more, we're getting the physicians and the Medicare people talking to us about, and they're literally saying words like, your lives are going to change like you never thought. And we're being fed in pieces of what's happening as far as what Obamacare is down the line. My patients themselves, who are that World War greatest generation, they're smart enough to know, and they'll point blank ask me and say, hey, doc, they really want us to die, don't they? And this is an exact quote from a number of my patients.
Well, and Doc, I've heard Sarah Palin running around talking about these death panels. Essentially, they make decisions under this legislation. They will have healthcare committees that actually make decisions whether or not they're going to continue the care depending upon the cost of the care. So I think that's properly termed death panels. Do you not?
Yes, I totally agree, and that is one of the many issues that has really, I think, motivated me. I've always, in the back of my mind, have had an attitude of preparedness and that sort of thing, and conservative medicine, and really sincerely trying to help and enable people. But it's when these types of things really are in print and are being discussed by lay people. These are non-medical people. And I'm not trying to insult anybody out there. I'm just saying these are non-medically trained people making these decisions over your life, your grandmother's life, your father's life, your uncle's life. And that, to me, is appalling.
Well, you know, Doc, I was in the state legislature for many years, and you would be amazed. These bureaucrats in Jefferson City, and I know they're the exact same way in Washington, D.C., these bureaucrats think they're God. They think they're the smartest people in the room. They don't have any formal education in whatever field they are making determinations in regards to what good policy, regulation, and law should be. These people literally have the power of life and death through legislation, and they have no medical experience. Why should these people be making laws regarding our everyday care through health care?
They shouldn't. In fact, the less is better, because what they should do is enable the professionals to give us the optimum amount of care that we can to patients, because a healthy population really costs less in the long run. And the irony to me is when you read books about what was occurring at the turn of the century into going into the early 1900s, and you see how the healthcare was improving vastly. The populations were doing much better, and the cost of to the economy itself was reduced in the sense that people were able to produce more, make more, and have a higher standard of living. We're seeing the reverse happen today, and that should be concerns for everybody. And like both of you have said, we want to stay healthy, and I tell my patients, you've got to be healthy to the best of your ability. And unfortunately, what I hope to convey at the expo is that, yes, some people are going to show up and have medical issues, and yes, there's an expression we use called damned by the DNA, and yes, sometimes your genetics may not be the greatest, but that sometimes doesn't mean that it's an absolute fact. It may be a predisposition to a particular disease or a problem, but it can be somewhat overcome or minimized by, good dietary habits and, exercise, just staying fit, turn off the TV, get up a little bit. Like, I don't know how many folks remember Jack LaLanne. He would yell into the television and said, "Get up off the couch and just move around, do something." But
poor Jack was a hero of mine. I know he recently died, like at 94, 95. But what a great physical specimen he was. Hey, Dr. Meccia, just hold on right there. We're going to take our first break in the program. We'll be back in just a few minutes. I'm Mark Wright. I'm here with the original survival economist, Vincent Finelli, on USA Prepares, and we'll be right back.
No whining. Only expert guests and seasoned opinions. Instruction that matters. At the controls, Vincent Finelli and Mark Wright.
And we're back on USA Prepares. I am Mark Wright. I'm here with Vincent Finelli, and we have a very special guest on the line, piping in live via Chicagoland area up in Illinois, Dr. Fred Meccia. Vinny, why don't you resume this very intriguing interview?
Dr. Fred, is it okay if I call you Dr. Fred?
Yes, you may.
Because that's what J.R. Moore calls you, isn't it?
Yes, Dr. Fred. I'm perfectly happy with that.
Okay, great. You practice medicine in geriatrics, podiatrics, and infectious diseases.
Yes.
And
in fact, right now I'm working on my board certification in wound care because I just developed it just as a consequence of working in a lot of nursing home facilities and working among the elderly, and unfortunately there's a rising number of diabetics, and I just took a great interest in it. It's always been an interest of mine, so I decided, a good buddy of mine down in Florida and we decided, why don't we just get board certified, and we've been working on that about the last year. In fact, we'll be sitting for our board exams in November.
Well, that's just wonderful. And we are so delighted that you're going to be at the Get Prepared Expo because we have so many baby boomers that come. The last time we had an expo a few months ago, we had, the paper said we had 6,500 attendees. And a lot of us are baby boomers. And, of course, those of us that are lucky enough to have our parents still with us, we are in the geriatric care business. And, of course, with geriatric care comes foot care and infectious diseases, because we seem to get diseases in the hospital staph infections and so forth. And you'll be talking about that at the expo, isn't that right?
I'm going to bring that up because one of the biggest problems we have, as you had mentioned, they're called nosocomial infections. And these are infections that you acquire when you have a hospital stay. And it's become a great problem. I mean, it's literally thousands of people per year dying, not as a consequence of the initial visit or why they're in the hospital in the first place, but as a consequence of these what's called nosocomial infections. And the biggest problem we have, and I'm sure many of the students out there are aware of these words, is MRSA, methicillin-resistant Staph aureus. Now, Staph aureus is all over the place, but many of these organisms, and I'm going to talk about it. I'm going to try to be, I'm not going to be very detailed, but I want to give people just a elementary idea of what we're dealing with. And MRSA is a really bad thing that's occurring right now, and I deal with this daily in the sense that almost every nursing home I walk into or facility, somebody's in isolation dealing with MRSA. The problem that we're experiencing now is, and And I don't want to fault a lot of doctors, but many times these drug companies push the latest antibiotics at the medical conferences, and doctors are very quick to go ahead and prescribe the latest, biggest, we call them big gun drugs.
Mm-hmm.
But I grew up I have family members that are physicians, and they're a lot older than me, and they said, look, always work from the bottom. I had a lot of old timers tell me that too, and I do. I'll do cultures and sensitivities, and I try to work with the cheapest and lowest end drug and work my way to the top, because the problem is, if you start using the big gun drugs right up front, you run the risk of there being an immunity after a while. I mean, these organisms, and I hate to, they don't have brains, but they become very adept at becoming resistant to the new medications, and we are rapidly running out of the ability to combat these Staph aureus to the point where vancomycin, which is like almost the last resort out there, mm-hmm. I've actually had in the last year 2 cases that I saw with my own eyes that were resistant to vancomycin, and that is an extremely scary situation. Medically.
Dr. Fred, can you tell us the generic names or the trade names from low to high of some of these antibiotics that we may recognize, so that as we get prescribed them, we could say to our doctor, well, can we go a couple steps lower? Can you give us a hint as to what they are?
Well, Vince, you're bringing up a great point. It's something I'm glad you said that, because I had the little points in my head I wanted to go over. What I highly recommend people do, your students do, and maybe many of them do, a doctor likes to see an intelligent patient. If you walk in and you got a piece of paper, I have a couple of patients that do that to me, and they'll have a list of the things that they want me to address mm-hmm. or have questions about. And I remember I used to hang out with my uncle. I have several uncles that are doctors, and when I was a kid, I hung out in my one uncle's office. And he would do that too. He would look at the patient. They would pull out their little list, and they would read them off. There are certain drugs. If the doctor's going to recommend a particular drug and just writes a script, once you receive that script, don't be so quick to leave the office. Turn around and say, "Gee, doc, what is this? What are you giving me? And at what level is this?" If they're prescribing Cipro, Duraflex is a very common infectious disease. When a lot of doctors, I notice that when I have initial foot infections that I'm consulting on, I'll see that the doctor wrote a script for Duracep, and that's a very low-end drug, very inexpensive, low-end. It works sometimes, oftentimes it doesn't. It's not a bad drug, and it's okay, but oftentimes, if you do what's called a culture and a sensitivity, which means they'll take, if the wound is weeping or you have an infection that's got a problem, they'll either take a sample of the fluid that's leaking out, or they'll do blood cultures. And then what they'll do is they'll match those to see which drugs are going to fight it, which drugs can defeat it. And then there's some drugs that are just resistant. They just the bug is just resistant to it.
Yeah. Dr. Fred, that's a question. I've had a family member recently going through exactly some of the things you're talking about, especially with foot, the foot care. And I know this family member has diabetes, had an ulcer pop up on the foot, and they started treating it with various antibiotics. And matter of fact, there's a machine. I don't know if you know about this, but I'm sure you do. But they have a machine that pushes electromagnetic waves at the foot to help circulation,
mm-hmm.
to help the foot get better because there was an infection, the ulcer on the foot. What about that particular machine, and also how many different types of antibiotics are we talking about in regards to fixing that situation?
Well, you're talking about a large number. There's a big number. There's very common ones, like for diabetics. The most common drug that I use for my diabetic patients is called Levaquin. So if you see that, if you have a diabetic family member or someone you know, most likely you may see that the drug Levaquin prescribed, unless they're allergic to it. Now some of these folks, you have